So we're looking at immunosuppressive therapy. Okay, so before we go in, it's very nice that we define terminologies. When you say immuno, you're basically talking about the immune system. Suppressive means something is holding something down. Okay, so therapy is basically, if somebody's immune system is very low, how can I be able to treat it? Okay, so immunosuppressive therapy is as follows. So general concept is immunosuppression therapy just involve drugs that reduce or inhibit the activity of the immune system. Okay, this one is not basically to treat it. These are drugs that their side effect is to what? Lower the effects of your immune system. They make your immune system weak. Do you understand? Okay, I get it now. So goal is basically to prevent immune mediated damage. So sometimes your immune system could be overacting and is to your disadvantage. So you give these drugs, they basically what? Keep the immune system very down. You understand? But sometimes the disadvantage is for the time that you are keeping your immune system down, if any infection comes in, you take it. So major classes of immunosuppressive agents, these are drugs that you can actually use to keep your immune system down. We have drugs like what? The glucocorticoids, like the prednisolone and also the methylprednisolone. So this one, they inhibit cytokine production, they reduce T cell activation. Okay, they are used mainly when you are suspecting that somebody's immune system will reject a transplant, and maybe the immune system is attacking the body's own cell. That's basically what autoimmune diseases. Okay, then we have other drugs like what? Under the category of what? Calcineurin inhibitors. Under the calcineurin inhibitors, they usually block calcineurin, so to not prevent what? Activation of T cells. So the less T cells we have, the lower the immune system function. Also using organ transplant and autoimmune disease. They'll have the anti-proliferative agents like the azathioprine. We have the Mycophenolate, mofetil. We have the cyclosporine. Also using autoimmune diseases and also the what? Transplant rejection, just to prevent it. The cyclosporine, this is what? Azathioprine. So next we have the what? mTOR inhibitors like the Tacrolimus and the Everolimus. This is what? Sirolimus. Okay, Sirolimus is actually Sirolimus, not Sacrolimus, like I said. Okay, then we have the biologic agents, that's the monoclonal antibodies, the ones that will inhibit interleukin 2, like the basilizumab, okay, the daclizumab, the ones that will inhibit the tissue necrosis factor, like the infliximab, the adalimumab, and the etanercept. Then we have the ones that will inhibit the CD20, that's a rituximab, okay, and the rest of it. Okay, so don't worry, when we come back and we're looking at examples of these drugs, you guys will actually get to understand the whole concept better.